last 10 years, more rural hospitals have closed in Texas than in any other state.
KMR local 4's Crystal Martinez went to West Texas A&M University to figure out what exactly is causing that shortage.
According to the Texas Organization of Rural and Community Hospitals, since 2010, nearly 26 rural hospitals have closed. Currently, 80 Texas counties have only 5 doctors or less. Panelists of healthcare professionals and a state representative discussed ways to solve this issue.
There's not one simple solution, I don't think, but one that is really inexpensive and could be quick would be allowing nurse practitioners to practice to the full extent of their authority, how they're already trained to do. And that's very simply seen across the U.S. and the other states that do that.
Several states allow nurse practitioners to diagnose and prescribe medications. However, Texas does not allow this without a doctor's supervision.
How they're already trained to do, and that's very simply seen across the U.S. and the other states that do that.
In Texas, there are nearly 1.5 million people living in these rural areas, yet many have to drive to larger cities to get the care they need.
We need to start recruiting our own kids that want to live in these small towns and bring them back here. And if we invest in our people, they'll invest in us.
Something a few clinics and medical students are considering.
I really didn't know a lot of those counties or small towns didn't have any kind of healthcare or a doctor where they can go and see. So when I heard the numbers and the statistics in this panel, really just motivated me and actually wanting to do something about it.
Now, panelists also discussed the cost of health care and if that could be a deterrent. Now, nurse practitioner Holly Jeffries explained the importance of preventative care to keep patients healthy so they won't need as much care from hospitals, since that's where many of these high medical bills stem from. Live in studio, Crystal Martinez, KMR Local 4 News. Andy, Jackie.
Crystal, thank you. Many hospitals and clinics in rural areas are now offering to pay for medical school while they practice medicine.
They hope by doing that, it will encourage students to continue practicing in those areas.